I have very bad tongue swelling that I've had for 3 years now that the doctors can't figure out, as well as really severe back pain, mostly in my lumbar spine, glutes, sciatica, down into my heel in my left foot.
Left foot. Okay. Where does it go into the left foot?
In the heel. It kind of feels like I'm like stepping on glass almost.
Can you point to me where in the heel?
Yep, right here, just at the
very bottom part.
Yep.
Gotcha.
Chronic fatigue syndrome and very bad brain fog as well.
Oh, that's what I reminder. Brain fog as well. Mm-hmm. So chronic fatigue syndrome, how long have you been having that, fellow?
15 years, about.
Okay. So usually, even though you sleep, do you feel rested when you wake up?
Never. I wake up as if I never slept. Constantly tired.
Gotcha. Yeah. And when do you feel like you need to have like a pick-me-up, like an espresso drink or whatever it is?
Within like 30 minutes of waking up, I'm like already exhausted. So coffee helps, but it's really about it.
Okay. You mind showing the viewers what's going on with your tongue?
Sure.
Yeah, that's very swollen. So as you can see, it's very swollen on the middle and on the sides and somewhere in the front. Okay. Any differences you notice in terms of texture or taste?
No difference in texture and taste. It feels super swollen in my mouth and down. Like I could feel it in the back of my throat as well. Swollen, and just like this whole area, like my chin, neck always feels bigger and more swollen.
So even your throat is swollen as well?
It feels it, yes. But I know it's the tongue causing it.
Gotcha.
I think it was.
How bad has it gone so far?
It's put me in the hospital into ICU many times, where the doctors don't know what to do except just keep me on observation in case I need a trach or to be intubated.
Gotcha. There's a lot to unpack with this case over here. Now, based on she's telling me presentation-wise and also with her low back, so already there's a couple of things, and also on the x-rays what I'm seeing, there's a couple of things we need to address. But also we've got chronic fatigue syndrome. So chronic fatigue syndrome typically is the lower dorsal of the area. And the fact that she has scoliosis, that's not helping either. So we got this area to focus on. Oh, that's right. You mentioned about during the consultation, liver is your issue too, right?
Yeah, supposedly.
Yeah. So that's what I'm seeing as well. It looks like a very bad compensation of the x-ray over there. So this could be mid-dorsal. I wouldn't be surprised that several dorsals in trouble. But more importantly is, and that's what I'm seeing here, it's all swollen right here, the neck over here. Okay. So the nerves that involves the tongue and the throat. So we got to check out what's going on with the glossopharyngeal nerve, the hypoglossal nerve, the trigeminal nerve, facial, and the vagus nerve itself. All right. So we're gonna focus, see what's going on at each of these stages over here. So clearly, when there is a damaged tissue, okay, your body starts that inflammatory process, and it goes without saying you're very inflamed. But in terms of local areas, your body will try to increase the vascular supply to the target area to introduce more white blood cells and deal with the issue on hand. So one of the side effects is going to be, the increased swelling edema localized, and that's what we're spotting visually, especially this really stands out here. There's some over here, some over here, here, and there. So this device over here picks up also annual temperature, and that's what we're picking up as well. So now, even though these are areas I'm marking, doesn't necessarily mean these are the areas I'm adjusting. These are just simply showing that, okay, these are objective data that I'm gathering right now, so I get to choose which is one we really need to address, because we need to triage this. First, way down there. Sick.
It's weird. It feels like my whole face and neck is like one big bruise. Like if I like put, you know what I mean? Like push on anything, it just is sensitive. It's so weird.
Gotcha. Right there. You got that. Way up there too.
That's really bad. I actually think that the one that's not the left, like this more center at the bottom, is a little worse.
That's what I figured.
How about this fellow here?
Not as bad as the others.
Okay, that's a 4.
How's this fellow right here?
Not bad. Ooh, that's
It's
a lot.
not moving though. It's sacrolumbar. Which was worse, the bottom
That one, yeah.
or top?
Bottom.
Bottom.
Which one?
How's this fellow right here?
Hurts, yeah. Oh, that does too.
Number 7. Tender right there, huh?
Mm-hmm.
Mm-hmm.
How's that fellow right there?
That's very sore.
Not too fun, huh?
Okay. It's the 4S seems to be tender. 2S. Okay. The left hip. 4th lumbar, 2nd lumbar, 12th dorsal, 7th dorsal. Okay. 5th cervical. Right. Now, a couple of the key points is this fellow over here. If this is subluxated, that means a bone that's knocked out of alignment and causing reduced nerve function to it. Basically, one heck of a traffic jam, just like this. The name of the game is we want to have a lot of traffic to it.
Mm-hmm.
Okay, but if there's nerve dysfunction to it, such severe traffic jam, and it does not flow too well, how do you split the information from your brain that goes to this adrenal gland? It's not going to work too well. So if this doesn't work too well, then that's where chronic fatigue syndrome comes into play. Where you go, you got no choice.
Right.
Because it's like this thing controls all that stuff. Okay.
Wow. Okay.
In addition to the fact that the medical doctors were dumping with prednisone, methotrexate, and all this other stuff, you further stress the adrenal glands, so that doesn't help either. Okay. So we've got that component. Now, if you have a problem over here, okay, it may result in liver dysfunction as well.
Mhm.
All right. So the other component is also now what we're talking about is the tongue. All right. So areas of the tongue, and that's what I saw on you when I was examining the tongue itself. Okay. There's certain nerves. Okay. So we're dealing with the vagus nerve. Vagus nerve deals with the very, very tip of the very back, and also the very on the side walls itself.
Mhm.
Okay. We also got glossopharyngeal nerve that's dealing with the motor function that controls all of it.
Okay.
We also have sensation-wise with the trigeminal nerve, and that's usually deals with the front half of it. Same thing with the facial nerve, also sensation. So all this area over here. But you did not report any change to taste or texture, so we could rule those out.
Yeah.
Okay. But also the same as well, the back part of it, I don't see any issues with that either.
Mhm.
You're not that swollen over there. It's just this middle center part.
Right.
This region right over here. That's mostly the glossopharyngeal nerve over there. And we also got the hypoglossal nerve as well. That's also affecting the mid part. So that could help explain what's going on with that mid part over there, that 5th cervical. Right?
Okay.
And you see over here, mucous membrane. It's all connected. Parotid gland, all the other glands right in there. Possible explanation with that. So let's look over the x-rays. So when I take a look at your x-rays over here, right, you have actually multiple things going on. And the fact of the matter that going over your past history, you used to do ballet, since you were a little kid, all until 16 years old. And on top of that, we also added horseback riding, and you were thrown off the horse a couple times. So horseback riding causes different kind of trauma. It usually causes like the upper lumbar region damage over there. Okay. Ballet causes a lot of issues in the pelvis itself. Okay. And on top of that, you got scoliosis. So every time I see scoliosis, usually a lower sacral nerve involvement. So that's why when we tested on you, and we also see on the x-rays here, that 4S, right, is very tender and uncomfortable.
Yeah.
But the other thing also as well is that this is what makes things interesting and tough to us to ascertain is the fact that because of the ballet, it distorted his pelvis a bit, right? Your gait and everything else is pointed to as, potential left hip rotation over here.
Mm-hmm.
I see some rotation, but not a whole lot. But here's the thing, when it rotates like this way over here, meaning your whole body rotates this way, I expect the rest of the body to rotate this way. Your body didn't do that. Your body started counter-rotating immediately towards the left. And that's what I'm seeing over here. And I follow that all straight to the very top. Okay? So that leads me, says, okay, there's something else going on, and we're going to focus on here, because when this thing goes out, it will cause also the 4S to be further activated. But I'm also taking a closer look at all these sacral segments over here. You should be all in proper alignment. But your 2S isn't doing that. You should be, see everything, well, your 4S is slightly out, but everything else is like decent in alignment, except here.
Right.
This one is a little tweaked this way,
Right.
just slightly. So we're gonna PLI on this one over here, so we need to address that one itself.
Okay.
And that would also help with this imbalance a little bit, but we'll take it from one step at a time. So right now the triage, this is what we need to address first. I'm gonna double check what's going on the fourth lumbar, second lumbar, this 12th dorsal with this huge rib. See, that should be symmetrical, but this is badly displaced.
Yeah.
Then you have the 7th dorsal over here, badly compensating, it's like tilted way over, okay? And that's also the nerve I explained before, goes to the liver itself. And in addition to, you got this 5th cervical over here. It's rotated towards the right, and also it's gapped open a little bit this way. This is the nerve that goes to your throat, all right? In addition to, part of the glossopharyngeal and the hypoglossal nerve goes from the 2nd cervical. But the reason why we're not adjusting that is because the way your atlas is located, your atlas is rotated toward and it's going forward on the right hand side. So in other words, your head, you're turning this way. But your axis, the 2nd cervical bone, the one right below it, is going the opposite direction. So if I adjust that bone, what it's going to do is it's going to cause your atlas even more this way.
Oh.
So yeah, you're not going to like that.
Okay.
So in order for us to center your atlas, go from this direction to more this way, is actually from that 5th cervical. So I would not be surprised the 2nd cervical just disappears. It's going to be one heck of a compensation. So it's going to knock out 2 birds with 1 stone. So that's what the strategy is. Let's get to work. That was a biggie. Okay, come on up. Walk around.
Okay, lighter. That feels a little better.
Come on up.
That feels better.
Good. One.
Ooh.
Okay. Little more. Let it sink. Got a part of it. Gotta get a little more out of it.
Alright.
Let it go. Let it sit. Here's the other part.
I feel a little taller.
Well, that's nice.
Yeah.
That's always a nice thing. How's your energy?
Good. I think I'm just anxious because of everything, but
I understand that. We did quite a bit.
yeah.
Okay. Normally, I don't want to adjust that many, but in your case, there's no choice because you have multiple type of different injuries.
Right.
It had to be addressed.
Right.
Okay. So how's your energy level right now?
Fine. I feel clear-headed.
Oh, the brain fog?
Yeah, I feel like clear right now. I don't know if it's that I got up too quick, like that.
Mm-hmm.
But yeah.
That's good.
Cool.
How's the left heel pain right now?
Fine. I don't feel it right now.
Nice.
Nice, yeah. Holy.
Clear the 2nd cervical.
Wow.
Clear up your atlas. Good. Okay. Walk around.
Okay. Ooh, that felt like a very big release. Yeah. I still feel swollen in my tongue, but I'm guessing that's not gonna like instantly go away, would it?
Well, every person is different.
Right.
How's the throat itself?
Feels the same.
Okay. All right. So this is your homework. All
Okay.
you should do is this. I need the ice over here.
Okay.
And also more importantly, the bottom part. It's just those two areas.
Okay.
I sit down 20 minutes every 2 hours.
Okay.
We're going to pump all that edema and inflammation down out of the way.
Okay.
The following visit, I want to follow up, see how it is with your throat, the swelling, your adrenals, your
Okay.
energy level, liver, the whole entire shebang.
Okay. Okay.
All right?
Sounds good. All right.
So
Thank you so much. Sounds
You're
good.
very welcome.
Perfect.
Bring up to speed. How's everything coming along?
Yeah, so the first 2 days after I saw you last, I had so much relief. I was able to walk my dogs, which I hadn't done in a couple of months. And then the past 2 days were really hard. So I think I saw you like 5 days ago. Just back to like really bad lumbar spine pain, and tongue is swollen again.
Okay, so for those first 3 days, okay, so you felt more energy?
I didn't feel more energy. I still felt just as fatigued, and I still felt the brain fog, but my back pain was like alleviated a lot. So.
And how's the tongue?
Tongue is still swollen. Do you want me to show the camera? Yeah.
Okay, all right. So during those 3 days, how was the tongue itself?
It was still swollen, but not this bad. It was tolerable.
So it shrunk down a
A
little.
little bit.
How much less would you say?
I would say maybe 20%.
20% less. Okay,
Yes.
hey, that's good
That's
progress.
good. Listen,
Okay.
anything, yeah. That's progress for me. So
Great. So
Yeah.
we'll keep chipping away at it.
cool.
Thanks
Awesome.
for the updates.
Sounds great. Yeah, absolutely.
All right. So how's the tongue coming
A
along?
little less swelling today. Looks better than normal.
Gosh. Yeah. That's coming along.
Uh-huh. Definitely better.
All right.
It's
Sweet.
exciting stuff. I keep looking in the mirror at it.
Well, I'm glad you enjoyed the
yeah,
results.
yeah,
here.
totally,
All right.
totally. For
Thanks
sure.
for the updates.
Yeah, absolutely.
So give us latest updates. How's everything coming along?
Things are going really well. My tongue is definitely way less swollen, so it's much more manageable. I can show you.
Okay. Yeah, that's great.
Significant difference from when I first came in.
Nice. How's the chronic fatigue syndrome and the brain fog?
It's getting better. Still there, but definitely progress.
Nice.
Yeah.
All right. Well, thank you for the update.
Yes, absolutely.